On today's World Insight, the UN is calling for cooperation to tackle the coronavirus. Can a united front tip the balance in fighting the epidemic?
International community has to come together to support such countries.
And the scientific community scrambles to find a drug that can cure patients sickened by the new coronavirus. What treatments are in the pipeline?
For some new technology vaccine, like nucleic acid vaccine, either RNA or DNA, it can be faster.
And finally, the coronavirus's most dangerous trait is its infectivity. How can doctors harness biotechnology to halt the virus?
The scientific capacity in China is much greater now, and many things are well underway in China by the Chinese scientists.
And here is our host, Tian Wei.
Hello and welcome to World Insight. The program is coming to you from Beijing. I'm Tian Wei. We start with the latest number on the coronavirus. The total number of confirmed cases in China has now surpassed 72,000. The death toll now stands at over 1,800, while more than 12,000 have recovered. The virus has spread to 25 other countries, which altogether have reported more than 800 cases. UN Secretary-General Antonio Guterres says China is making great efforts in fighting the novel coronavirus. The UN chief added on Sunday that he believes the epidemic will be overcome. He also warned that discrimination against China is inappropriate. From the United Nations perspective, how has China dealt with the outbreak so far, and how should the global community work together to cope with the virus? With all these questions in mind, I earlier talked to Nicholas Rosellini, the UN resident coordinator in China. Let's hear what Mr. Rosellini had to say. Tell me more about how the UN family here in China have been supporting China from the very beginning of this crisis, and also interacting with your headquarters.
We've been looking at ways and means to support China during a very difficult time, and we immediately understood that there'd be shortages in terms of essential medical kits, the protective gear and the masks and so on. We've been helping to ship the protective gear in. From late January, we've had supplies arriving from various UN agencies. I think UNICEF was the first to arrive, but we've also had from UNDP and UNFPA on the way. IOM and many others have been supporting the efforts. So we recognize that the needs are vast. And while production has to ramp up in China, there is a need for the international community and the United Nations to see if we can help fill some of these temporary gaps.
Mr. Rosellini, I also understand that there is a WHO expert team now in China this week, with both those coming from the WHO headquarters as well as experts coming from different parts of the world. I understand as a UN coordinator here in China, Mr. Rosellini, you are also working with this team. Tell me more about the latest as to what the team have been working on and how you've been working with them. What outcome at this point you can brief us about?
Well, I think it's a little early to talk about outcomes. The main team, I think, arrived at the weekend. I was briefed by the team leader earlier last week. And this is very much a WHO-led technical multidisciplinary mission with experts from around the world, partnered with Chinese experts as well. 12 experts from the international health community, including WHO, plus 12 experts from China. I think the main interest is to gain a greater understanding of the coronavirus, novel coronavirus, its transmission, its severity, and the control measures that have been taken by China and how effective they've been. So I think it's to create a higher level of understanding in the international community, to understand China's response and to understand the virus better. This is very important for other countries because other countries who have maybe weaker health systems than China also have to prepare in case the virus spreads more widely internationally.
We understand the team have been going to different localities in China, but not including Wuhan. How should we understand this, Mr. Rosellini?
Well, it's important that they do see what's happening at the provincial level, but at this time to visit Wuhan, which is in the middle of the emergency, where the health services are very stretched to provide support to the local population, maybe it was not the best time to go there and distract attention from the medical care and medical services that people in Wuhan need. So hopefully on a future visit they'll be able to visit there. But they are getting an idea of local requirements they are visiting a couple of provinces, I believe, and they will get an idea of what's happening at the local, provincial level and the kind of capacities of local health management services.
Are they going to, and are you going to just talk to the official side of China, or also going to talk to individuals, hospitals, research labs, as well as various factors in the civil society in order to get a better assessment, Mr. Rosellini?
I think some of the questions you'll have to ask WHO directly. I have a general overview of what they're doing, and I do believe they will be reaching out to a broad set of partners, I mean, to get a good idea in terms of what's happening, both from a scientific aspect as well as from a health aspect.
Yeah. Mr. Rosellini, you and your colleague of UN Family in China have been working from day one when you were asked to provide support, and also have been offering your support. Let me understand, and also our audience understand, at this critical moment, the medical supplies are very hard to come by. How did you manage to reach out and branch out in order to get these urgent supply at this very early stage, shall we say, Mr. Rosellini? What does it take?
Well, the UN works in emergency situations around the world and has fairly strong procurement capacity. So unfortunately, this is not a new thing for us. We have these experiences in terms of epidemics, health emergencies, in terms of natural disasters such as floods and earthquakes. And in many cases, local supply chains are disrupted, and urgent support is needed from outside the country. And the UN often steps in these situations to provide immediate emergency needs. We have stockpiles, we have warehouses in various countries, and we can draw down on the supplies we have. We also have very good links with international companies to do procurement, and we tend to know where to go. So we have a good international procurement network which we can draw on at very short notice, 24 hours a day, 7 days a week.
Mr. Rosellini, even you personally have been working in Africa and dealing with various crisis management situations. How do those earlier experiences and also coordinating capacities that you have learned in some of the early cases helping you right now?
Well, I think the main thing is to react as quickly as possible. You can't wait for long processes. You can't always wait for more evidence before taking decisions. What is important is to act as quickly as possible, I think. When one looks at the causes of some of these emergencies, they can be very different. And I've already mentioned natural disasters, and there can be very different kinds of health emergencies as well. But what is important in all these situations is preparedness and a strong health system, health management capacities. And unfortunately, until these crises arise, in many countries, there isn't enough investment in the health system, and there isn't enough investment in preparedness. So I think one lesson learned from around the world for many years is that while the immediate response to emergency needs, of course, is critical, if one wants to avoid these situations over the longer term, investing in strong and resilient health systems is very important, and investing in other preparedness measures is also extremely important. And I think this is the risk in terms of this virus, that while China has quite a strong medical system, if it spreads in countries with weaker medical systems, it'll be much harder to control. So we hope that the preparedness measures now being rolled out in many countries will be effective.
Yeah. Prepare for the rainy days and make sure everything is in the right place on the usual days so that when things come, we could better handle that. Thank you so much for that advice.
Yes, exactly.
Having said that, though, Mr. Rosellini, China has been taking some very strict quarantine and also prevention and control measures that you have witnessed since the outbreak, particularly since the 23rd of January. Now, Mr. Rosellini, there are two sides of this. On the one hand, those strict measures, very important for save people's lives. On the other hand, there is also the respect of human rights and also the respect of people's freedom of actions. So, Mr. Rosellini, from your perspective, how do you see the city lockdowns, the community protection, and some of the strict quarantine measures? Mr. Rosellini.
Yes. Now, I think one always has to strike a balance at a time of an epidemic, of an emergency. One has to strike a balance between individual rights and the need for safeguarding the community. And this balance, of course, may not be the same in every country. I think some of the measures taken in China to protect the community would be very hard to implement in some other countries. So I think that balance may differ from country to country. But I think at the end of the day, one recognizes during an emergency, one has to look at the well-being of the community as a whole, and one has to take certain actions. One hopes that these will be very targeted and short in duration, but if they help to blunt the peak of the epidemic, then they are needed.
Mr. Rosellini, since the very beginning of this outbreak, when China was briefing the international community, both the UN Secretary-General as well as you and the UN family here in China, together with WHO headquarters as well as WHO office here in China, have been advocating, on the one hand, make sure prevention and control among all the countries, but on the other hand, make sure we are not going to have xenophobia, racial profiling, having a freedom to come out and try to seek their playground. So, Mr. Rosellini, how do you see the current stage of things regarding these areas? Are we improving, or we are still facing a longer danger?
Well, I have seen probably some of the same news clips and videos that you have seen, and certainly one can see some very irrational responses. And I cannot emphasize enough the message from the United Nations Secretary-General about compassion and solidarity, which is extremely important. Now, how do we address some of what we've seen? I think information transparency is very important. People tend to panic when they don't have enough information. And I think we need to continue to emphasize that this is an international issue, that the WHO is not advocating harsh restrictions on movement or of trade. And we really need the international community to come together out of solidarity and out of compassion to join with China, and not only China, but other countries that are also having outbreaks of the virus. So I hope we can turn the tide on this, and I've seen a lot of encouraging messages from local communities around the world, from schools around the world, encouraging China to be strong and showing a lot of compassion for the people in Wuhan. Mm-hmm. So I hope at the end of the day, when we look back, that will be the message we remember.
So this should not be the time when geopolitics is trying to lead the discussion, right?
I think not. This is a global challenge. This is a challenge to health systems in many developing countries. And this is really when the international community has to come together to support such countries.